I would say that to really understand where we're at today, you need to go back at least to the 1800s. And in the 1800s, that's when we really see medicine as a profession transform. And this is happening not only in the United States, but in other countries as well. Doctors in the 1800s in the United States had a really hard time actually making a living. They often had a hard time finding enough patients, getting a stable income. Of course, at the same time, you have tremendous changes in the intellectual foundations of medicine that are also happening in the 1800s, and these become really critical. So over the course of the 1800s, particularly the late 1800s, we see germ theory arise, where suddenly disease is caused by specific microorganisms. We also see antiseptic methods in surgery start to develop, and increasingly surgery is actually able to fix people. In the United States in the late 1800s, we see a number of industries provide some sort of health care. So if you think about railroads, mining industries, logging industries, particularly industries that are taking workers to very rural areas, areas on the frontier where there's not a lot of healthcare options. And it's interesting because the railroad industry in particular ends up developing this incredibly vast system of healthcare in the United States, including dozens of hospitals that in some cases would actually take non-railroad employees as well because it was the only hospital in the area. And railroad doctors were often hired on a contract basis. So in contrast to what a lot of other physicians groups were trying to do at the time in terms of raising salaries, shifting to or maintaining a fee-for-service basis for treating patients, you see these contract physicians getting a set salary from whatever industry or company was employing them, and they would treat people from that salary essentially.